Dr. Frederick Ruysch, the prominent physician and artist of Vanitas. The art of modern anatomy emerged as a new science in the Golden Age of Holland. At that time, a better understanding of the anatomy and physiology of the body transformed the insight and understanding of physicians, heralding great advancements in the field of pregnancy, cancer treatment, and many diseases. One of the flag bearers of these developments was Dr. Frederik Ruysch, a distinguished physician with a passion for art. Dr. Ruysch's multifaceted expertise as an anatomist, botanist, pathologist, anatomical preparer, and painter, as well as the compassionate and selfless actions of this ethical doctor, contributed significantly to the fields of medicine and art. In the history of medicine, few figures have left an impact as profound as Dr. Frederick Ruysch. Ruysch, renowned for his pioneering work in preparing his dioramas and anatomical paintings, by using creative and pioneering methods, created over 2,000 unique anatomical, pathological, zoological, and botanical specimens with exceptional precision and delicacy, earning admiration and accolades from medical professionals, political leaders, scientists, and researchers. In 1683, a painting titled The Anatomy Lesson of Dr. Ruysch was drawn by Jan van Eyck. This painting depicts Dr. Frederick Ruysch wearing a large hat symbolizing leadership, engaged in dissecting the body of a newborn infant. In all the historical medical paintings, this is the first instance where the body of an infant, symbolizing innocence and purity, is placed on the dissecting table instead of a criminal awaiting execution, revealing numerous truths and mysteries to be told. With the transformation of the medical community, the science of medicine rapidly advanced, and the practice of dissection and autopsy, which used to be a display of demonstration of the power of political leaders and religious figures, moved away from the influence of politics and religion, becoming a magnificent achievement for the advancement of medical science. As a result, Dr. Frederick Ruysch, who was at that time the head of the Amsterdam Society of Obstetrics and Gynecology, commissioned a painting from a talented contemporary artist named Jan van Eyck, in which his portrait is depicted dissecting an infant's body. In this painting, Dr. Ruysch is shown with rhythmic movements displaying the infant's umbilical cord. The subject that Dr. Ruysch is teaching involves the placenta attached to the baby on the table, with one of the assistant surgeons pointing to it. Dr. Ruysch had conducted extensive research and thorough studies on the placenta. He believed that the placenta is attached to a particular muscle in the uterine wall, and this muscle causes the placenta to come out after childbirth. Today, it has been proven that such a muscle does not exist, and the uterus naturally performs this task. The uterus expels the placenta as part of the birthing process. However, at that time, midwives forcibly pulled out the placenta, causing severe bleeding. Therefore, Dr. Ruysch attempted to educate physicians on this important issue by commissioning such a painting, emphasizing that if midwives patiently wait, the placenta will separate naturally, reducing the risk of severe bleeding. He requested the city council to focus on training specialists in the field of gynecology and childbirth, and performed a series of childbirths as examples for physicians, significantly elevating the scientific level of women's care during childbirth. On the right side of the painting, a young girl holds the skeleton of a newborn. This girl is none other than Rachel Ruysch, his daughter. From childhood, her father recognized her talent and brilliance, and with Rachel's help, collected and catalogued his rare historical specimens, revolutionizing the preservation of anatomical specimens. Rachel Ruysch had the most accurate look at the details and executed the most delicate designs, and later became one of the famous Dutch painters. Dr. Ruysch possessed remarkable talent and brilliance in both medicine and art. His potential as an artist and profound thinker was evident in his astonishing and revolutionary works, representing a unique intersection of art, society, and anatomical science. His imaginative and surreal paintings stem from his deep interest in obstetrics and gynecology. Dr. Ruysch presented a unique perspective on the knowledge and anatomical methods of his time as a pioneering anatomist. He made significant contributions to understanding human anatomy, especially in embryology. Ruysch's dissections and precise images provided valuable insights into human body growth and laid the foundation for future advancements in medical science. In Dr. Ruysch's paintings, we are confronted with a juxtaposition of macabre beauty and transience. The delicate and intricate details of flowers, insects, and other natural elements are intertwined with the bitter reality of human anatomy, often skeletons of infants. These ethereal and frightening compositions, both evocative and eerie, serve as a stark reminder of the fragility of life and the inevitable passage of time. In one of the paintings, as we see, Dr. Ruysch places 5 infant skeletons, identifiable by their fontanelle skulls, in a grandiose natural arrangement. Earthly soil at the bottom and trees emerging from the soil are adorned with beautiful blossoms. However, this is not the truth. These elements are actually intestines, viscera, muscles, and body tissues designed in an earthy manner, adorned with gallstones and bladder stones. Veins and arteries resemble trees, and the skeletons serve as a metaphor for tree blossoms and flowers. Each of these skeletons is engaged in a task. The upper skeleton holds a bone like a violin and holds a dried artery like a bow, while facing the sky, playing the song of death with a silent melody. Another skeleton, like a playful child, climbs up from veins and waves its hand. The right side skeleton is decorated with intestines and is playing a wind instrument. The left side skeleton, adorned with a large decorative feather emanating from its head, is depicted. In the foreground at the bottom of the painting, a sleeping infant skeleton is drawn holding a dead butterfly in its hand, creating a beautiful contrast with a cheerful and happy child who chases after a butterfly to catch it. The use of infant skeletons in Dr. Ruysch's painting serves as a powerful visual reminder of the passage of time and the impermanence and instability of existence. The juxtaposition of delicate and small bones against the dark background of death creates a thought-provoking image that prompts viewers to contemplate the brevity of life and the inevitability of death. In fact, Dr. Frederick Ruysch's paintings are considered Vanitas in every sense. The Vanitas style aims to symbolize death. It signifies the transience of life and the inevitability of death, condemning all the fleeting pleasures of life. Including infant skeletons in Vanitas art can evoke themes of lost innocence and the harsh reality of death. This important detail serves as a poignant memento, reminding us of life's transient nature and the importance of cherishing every moment. Infant skeletons can also be seen as symbols of vulnerability and the frailty of youth, prompting reflection on the fragility of human existence. Therefore, by depicting skulls, bones, feathers, dead butterflies, the fleeting sense of music, and living skeletons with an undeniable vitality, Dr. Ruysch has created and showcased one of the most masterful and exquisite works of art in the Vanitas style.